Is your child itching their scalp like crazy and there's been a lice outbreak in your school, wondering if it could be lice and what to do about it? Today's episode is for you.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. We've had some local outbreaks of lice, so today we're going to talk all about this itchy topic, how it's diagnosed, and what to do about it. So let's jump right in. First, I want to talk a little bit about how we diagnose lice. So one of the important things to note, and sometimes people are not aware of, are that lice, the primary symptom, which is itching of the scalp, that actually takes a quite long time to develop. Typically 4 to 6 weeks after you've become infected with lice, you develop severe itching of the scalp. So prior to that, the first 4 to 6 weeks, you might actually be totally asymptomatic. And this is typically how lice spread so quickly because in those early 4 to 6 weeks, you're not aware that you're carrying them, but you are able to spread them. So what do you do if your child is scratching their head and you've had a lice outbreak either in your school or your local community? The first thing you want to do is actually take a look at the child's scalp or bring them to your physician to take a look. Doctors typically will look for lice at the nape of the neck and the base of the ears. Typically, like this picture shows really nicely, lice and nits can look a lot like dandruff. But the difference between a nit and dandruff is a nit is actually very difficult to remove. It tends to be at the very base of the shaft, like you can see here, because they need body temperature to survive. They can't really be at the tips of the hair. And they most actually commonly resemble small little white sesame seeds, just like dandruff. So if you think that you might have or see a nit, and it's very easily pulled off the hair shaft, it's actually probably unlikely to be lice or a nit. But if it's really difficult to remove, then I would definitely recommend that you bring your child in to see their healthcare provider. So how do lice actually get transmitted? So transmission of lice actually has to occur from hair to hair contact. Unlike other insects, lice do not jump very well. So they cannot jump like we typically think of, for example, fleas jumping from cats and dogs, etc. They actually need to be in quite close contact with the base of the hair to another hair follicle. So typically, hair-to-hair transmission occurs when an infected person is sharing something like a hairbrush or a hat and transmits those lice to another person. The other lucky thing about lice is they actually need a blood meal every 24 hours, so they don't survive very well on surfaces like on pillowcases, for example, or bed sheets or couches, because they need to be on a human within 24 hours. So I think another really important thing to note here is that poor hygiene does not play a role in transmission or requirement of lice. So it has nothing really to do with hygiene factors, whether you are at risk for obtaining a lice infection or transmission. It really has to do with close hair contact with an infected person, regardless of your hygiene status. And I want to make this point because I think there is a little bit of a social stigma associated with lice infections, but in fact, it really has nothing to do with the host or the patient who's acquired them. It's just unfortunately really bad luck. So let's say your child has now been diagnosed with lice or yourself and you're wondering what is the treatment going to be. So typically the first treatment step requires combing a lice comb or combing out those nits. So this is a really good picture of a nice lice comb. What I like about this picture is it has metal teeth, which makes it easier to identify the nits. And it has a little magnifying glass on the end so you can see them more easily. Pro tip here, I find it much easier to comb out the hair if you have conditioner in your child's hair. So usually I recommend that you put the conditioner on first because it will be much easier to actually comb through their hair and remove the nits. So after you've combed out your child's hair, the next step is to use a medicated shampoo. Over-the-counter Permethrin 1% is available for patients who are 2 months and older. You're going to want to put the shampoo all over their head, wet the hair, pat it dry, rinse the medication out, and then actually repeat this again 9 days later. Permethrin 1% is definitely the safest option out there with the least amount of side effects. However, unfortunately, we are seeing many strains, especially in this area, that are resistant to permethrin. Unfortunately, these medications are still quite expensive. And so our first recommendation is still permethrin 1% because they are less expensive and also safer. The secondary medications tend to cause a lot of itching reactions. The third part of treatment of lice is decontamination. So all hats, helmets, pillowcases, clothes, bedding, carpets, car seats, rugs, anything that can be put in the washing machine should be put on the washing machine and washed and disinfected at 130 degrees Fahrenheit temperature or greater. For those things like rugs and couches that obviously cannot go in the washing machine, you want to vacuum them and clean them well. And then throw out any brushes that the infected person has been using. There are some services that will come to your home and do this all for you. So that might be another option and another luxury if available to you. What you absolutely do not need to do is shave your child's head. So I really want to emphasize that. There's no reason to shave your child's head to remove lice. You also do not want to use things like bleach, alcohol, or DW-40. It's really the high temperature that helps kill the lice, and vacuum. Generally, we do treat all household members and close contacts of a patient infected with lice because those 4 to 6 weeks where they were infected but maybe not symptomatic, there is a greater risk of transmission. So typically when a child presents with lice, I would treat the entire household. But again, I recommend if you're concerned about lice, you reach out to your healthcare provider and have that discussion with them. The last thing I want to talk about is return to school because that can be a really stressful part of the lice diagnosis. In the past, the recommendation was for a child to have no-nits to return to school. However, that's a really outdated recommendation. We really published updated recommendations in the Journal of Pediatrics in 2022, which really recommends that children return to school when they have no more live lice identified. Nits can persist for weeks, making children miss school for many more weeks and are unable to transmit Lyme's disease. So again, no-nit policies are very out of date. They keep children out of school longer and are unnecessary as they don't reduce the transmission of lice themselves. So if you're going through this difficult time, because it's certainly very stressful to have a child with lice, I hope that you find this episode empowering and helpful. If you have any questions or comments, as always, please leave them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.